Namaste viewers, welcome to our live session. We are doing a live session on varicocele, and for our discussion we have with us Dr. Raghavender Kosgi, consultant andrologist and urologist at Apollo Hospital, Jubilee Hills, Hyderabad. Hello doctor.
Hello everyone.
Welcome to our live session. Starting with our first question, what is varicocele?
So varicocele is enlargement of the veins which are located in the scrotum, which are dilated. So whenever these veins are dilated, we call it as a varicocele. So to go into the depth of the varicocele, exactly what it is, before going to the varicocele proper, let me explain what is normal. So in human body, blood circulation happens in a cycle fashion. It comes from the heart, the oxygenated blood, and deoxygenated blood goes towards the heart. So it happens in every organ of the body. Same thing is true for the even for the testis. So from the testis, oxygenated blood comes from the testicular artery or internal spermatic artery towards the testis, and deoxygenated blood, what we call it the bad blood, goes towards the hearts for oxygenation from the lungs. So this is a cycle. So whenever this blood flow is interrupted because of some damage to the walls within the veins, that causes varicocele.
What are the symptoms of varicocele?
Varicocele, in majority of the patients, it will not cause any symptoms. Most of the patients will diagnose during an incidental. They come for something else, maybe scrotal swelling or some pain in the testis or some fertility evaluation. Just because of infertility, they will come to us. Whenever doing physical examination, we will come to know that there is a varicocele.
What are the effects of varicocele on male fertility?
Varicocele will cause sperm related problems, especially it can reduce the sperm count, sperm motility, that is movement of the sperms, and sperm morphology, that is a structure of the sperm, will be abnormal in patients with varicocele. Varicocele usually it is present in 15% of the normal individuals also, where it may not cause effect, but in majority of the patients it will have impact on the semen parameters. On top of that, even varicocele may cause abnormalities in the oxidative stress, and it may cause high DNA fragmentation. Regarding these two topics, I will elaborate in my next videos how exactly varicocele causes these abnormalities. So to extension to my first question, so this varicocele, so probably in clinical practice, we see majority of the patients, especially whenever they are coming for the fertility issues.
How to diagnose varicocele?
So as I told you, majority of the patients are asymptomatic, that means they don't have any issues. On physical examination, we see these patients. First, whenever we'll ask the patient in a standing position, if we feel the varicocele on Valsalva maneuver, we'll do a small procedure with forced Valsalva, where patient has to close his nose and should push belly out. So that raises the intra-abdominal pressure so that we can feel the varicocele. If that happens during this Valsalva maneuver, that is called, it is a grade 1 varicocele. If I can feel the varicocele without performing this Valsalva maneuver, I will call it as a grade 2 varicocele. And sometimes even I can see the varicocele at a distance, that is visible varicocele, that is called grade 3 varicocele. This is what we call, in some patients it looks like a bag of worms. It appears like there is a bag with worms inside. So that is a advanced varicocele. So this is what clinical examination grading system. It is a Dubin-Amillar grading system. But this physical examination grading system may be different from scrotal ultrasound grading system. Whenever we suspect varicocele on clinical examination, will confirm this varicocele with the scrotal ultrasound Doppler. I request my radiology colleagues and to the patients, whenever you are undergoing a scrotal Doppler test, it should be done first in a standing position, followed by in a lying down position for better diagnosis of the varicocele. And grading system of the varicocele from the physical examination grading is different from radiological grading. In the radiological grading, as per the ultrasound, there will be 5 grades may be there. Accordingly, we will discuss with the patient.
What are the treatments available for varicocele?
So for varicocele, as everyone should understand, there is a structural problem. It is a anatomical problem. So anatomical problem will be corrected by the surgery only in majority of the cases. So surgery is the best modality for fixing the varicocele. So out of which various options available, subinguinal microsurgical varicocelectomy is a gold standard procedure, and it overscores other procedures like radiological embolization or laparoscopy or some other open procedures. So now with a lot of evidence is there across the globe for subinguinal microsurgical varicocelectomy for better results, and it is more cosmetic as well as it is a daycare procedure. Majority of the patients, they'll come and ask me how does embolization works. So radiological embolization is inferior to microsurgery for various reasons. The reason here, in 20% of the cases they may not access internal spermatic vein, and in 50% of the cases there will be an external spermatic vein which no way they can access external spermatic vein by the way of radiological approach, and recurrence rate is very high when compared to microsurgery with radiological embolization. So microsurgery is a preferred option. If there is a failure of microsurgery, probably in those patients where radiological embolization may be a preferred option, because they will be doing a venography so that they can assess any external abnormal communications. So it is not as a first modality, maybe as an alternate option in the later very rare cases it may be needed.
What is the best treatment for varicocele?
So that's what I am telling. So for varicocele, subinguinal microsurgical varicocelectomy is the best modality. Even many people use loops. It is like a spectacles they use during surgery. That is not sufficient. Varicocele surgery usually we will do under 10 to 15x magnification, where we need to identify very tiny blood vessel that is a cremastic artery or internal spermatic artery which supplies the blood flow to the testis. Because coming to the blood flow to the testis, almost 80% of the blood flow comes from the internal spermatic artery. So preservation of this artery is very critical for better results for the patient. So if we are wearing the loops or if you are doing with the naked eye, we cannot preserve this artery. So that is where microsurgery scores over other procedures. So with microscope, with higher magnification, we can preserve the artery, and during surgery we can take help of the intraoperative Doppler to identify the artery, so to preserve it in a better way. Probably that's where patient will get most benefit out of it.
What are the precautions after varicocele microsurgery?
So after microsurgical varicocelectomy, in majority of the patients we will do it as a daycare procedure. Patient will get admitted just 1 hour before the procedure and will discharge them after 4 to 5 hours post procedure. So after surgery, just we will tell them 3 instructions. There should not be any intercourse for 3 weeks. They should avoid heavy weight lifting, and they should wear some scrotal supporter to avoid small swelling or edema, whichever that happens post surgery. Otherwise patients can resume their daily activities after 2 days.
After microsurgery, when can we expect improvement in sperm count?
So post microsurgery, it will not be an immediate result, because spermatogenesis, that means the formation of the sperms, it will take in the human body from 70 to 90 days. That means one spermatogenic cycle will take around 2.5 to 3 months. So at least we have to give 2 spermatogenic cycles, that means 3 months to 6 months. So ideally post surgery we will check at 3 months, and at 6 months we will check the semen parameters. Majority of the patients will get benefit at 6th month. Even if there is no benefit at 6 months, depending upon the age of the female, age of the male person, volume of the testis, so then we can guide the patient for the next one of the available ART, that means artificial reproductive technique procedures, that in simple patient terms, test tube baby related procedures we can advise them. So at least they should wait minimum 3 months to up to 6 months. In some patients improvements may go up to 2 years also, because post surgery we see at least 10 to 15% of the patients they will get natural pregnancies, and semen parameters will improve almost in 70% of the patients at 3 to 6 months.
Can varicocele occur after surgery?
Yes, Post varicocele microsurgery also varicocele may occur, so but it is less than 2% of the patients. This is because if it is happening immediately after surgery, probably we might have missed some veins during surgery, or if it occurs in the later phase, it means 3-4 years, there will be an alternate channels are forming. What we call it is a collateral formation or recanalization may happen after 3 to 4 years, but it is less than 2%. If it happens by the time sperm parameters are improved, pregnancy is there, we can ignore, or else still patient is having the semen abnormalities, still there is no pregnancy, we can reconsider in those patients by redo microsurgical varicocelectomy, or this is the area where we can take help of the radiological embolization, because where they can do a venography so that they can identify any abnormal communication.
Will varicocele cause erectile dysfunction?
So majority of the patients, they'll ask me, is it related to any sexual related issue, varicocele? So varicocele and sexual related issues or erectile dysfunction, absolutely they are not related. Varicocele will not cause any erectile dysfunction, for that matter any other issue related to sexual life. And majority of the patients, they worry about post surgery, will it cause any sexual issue or erection issue. Sometimes they feel that when they are undergoing surgery, because the male person is a breadwinner of the family, something will happen to the male person. Absolutely no, it is a minor microsurgical procedure. It will not cause any erectile related issues or sexual related issues, or it will not cause any physical deformities or physical weakness to the patient. It is a safe surgery, and as it is we are performing, it is a daycare procedure. They can resume their activities as early as possible.
Varicocele, is it curable with medicine?
Yes, so most of the patients, whenever I say in the clinic that there is a varicocele, immediately they'll ask, will medicine will work? So you should understand it is a structural problem. There is a problem in the veins. So to explain it further exactly what is the problem, there is a blood flow, as I told you, it is a cycle formation. Whenever bad blood or deoxygenated blood is going towards the heart, so there will be a wall within the vessel. So once blood goes, it will open and it will close. In patients with varicocele, there is a damage to these walls. Because of that, partial blood flow will come back. Whenever blood comes back, there will be a pooling of blood within the testis, so that there will be a swollen vessels, which will cause temperature alterations. So to explain it further, in the human body, when compared to the rest of the body, there is a 1 to 2 degrees Celsius temperature is less within the testis. So whenever this blood is coming back and there is a pool up within the scrotum, that raises the temperature. Whenever this temperature is raised, hormones and enzymes related to the spermatogenesis, that is sperm formation, may not work well. So when this hormonal imbalance as well as enzymatic dysfunction is there, that will lead to abnormal sperm production. So it will affect on the sperm parameters. So this structural problem we cannot clear with any medicines. You should understand varicocele is a structural problem. If you are not operating, if you are not undergoing for surgery, it will progress slowly. So there is no medicine which will cure varicocele. So probably in indicated patients, we will not operate in every patient who will come to us for the varicocele. If patient is having a palpable varicocele, that means which I can feel in my OPD with examination or in the ultrasound, which is a higher grade varicocele. If the patient is having a small testis, that testis size is small, or if the patient is having chronic pain that is related to testis, if there is a long duration pain is there, for those patients probably with abnormal semen parameters, where wife evaluation is normal, so probably these are all the patients who will take up for surgery. It is not in every patient will operate.
Thank you, doctor. Coming towards our last question, doctor, could you please tell our audience about the facilities provided at Apollo Hospitals, Jubilee Hills, Hyderabad?
So in our department, in Apollo Hospital, Jubilee Hills, we have related to fertility. We can do, and the highest Joyce microscope is there. We can do microsurgical varicocelectomy. We can perform that whenever there is an obstructive agiospermia, whenever there is a blockage. So probably for those patients, we can do microsurgical vasovasostomy or vasoepididymostomy. That means these are the microsurgical procedures for any blockage to relieve. and we can do related to sexual dysfunction. For erection issue, we can do penile implant surgery, and we can do the stapler circumcision, which is a cosmetic and faster recovery procedure. We can do for the patients who have completed their family, where we can do a no scalpel vasectomy without any incision. All these are the daycare procedures. And for patients with erectile dysfunction, we can have a shockwave therapy also. So probably they can avail this opportunity, and we can have a sperm cryopreservation, sperm banking. These are all the facilities are available in our Apollo Hospital, Jubilee Hills, Hyderabad.
Dear viewers, we have come to the end of our session and hope we have covered all aspects. If you still have more doubts, you can book an appointment with Dr. Raghavender Kosgi and clarify your doubts. Thank you, Doctor, for educating our audience in today's session. Thank you for joining us. Stay tuned for more such educative live sessions. Namaste.
Thank you.